Survivor. If you're dealing with cancer, you probably see and hear this word a lot. Some patients hate the label and bristle whenever someone calls them a survivor. Others love it, wearing t-shirts and bracelets that announce to the world, I'm a survivor. As a cancer patient myself, I've both benefited from and struggled with the label. This one word causes a variety of reactions because it means different things to different people. As part of my professional work addressing the challenges of life after a cancer diagnosis, I decided to explore what this label means today. My goal was finding ways to help other patients minimize distress triggered by the label. Unexpectedly, despite decades of reading and writing about survivors and calling myself a survivor, thinking about the label's strengths and weaknesses led me to see survivor in new ways, in ways that have helped me as a patient ever since. I found it helps to keep in mind the label's role in history. When I first faced cancer in 1990, patients were called cancer victims. Lucky for me, the week of my diagnosis, I learned of the new label. Calling myself a survivor kept me from ever feeling the powerlessness or the shame of being a victim. At the same time the label was making life better for me and countless other patients, it was also helping advance the survivorship movement that changed the culture of having cancer, so that today, routine cancer care, like the care you're receiving, addresses patients' emotional challenges and risks of after effects. In the handout, I encourage patients to consider the legacy. It helps to remember that when survivor was introduced, the word was strongly linked with the ideas of hope and empowerment, ideas you can tap into today whenever you hear the word survivor. You'll also find a list of logical reasons why patients may feel uncomfortable with the label and some simple tips for overcoming distress. How you deal with the word survivor matters. Use this handout to help you hear and respond in whatever ways help you get good care and live as fully as possible every day.
Welcome to Oncology Patient Handouts and Resources, powered by Oncology Times and the Nurse Practitioner. Here you'll find helpful, hopeful handouts by Dr. Wendy Harpham. Since 2005, Dr. Harpham has been writing our award-winning column, View from the Other Side of the Stethoscope. Her perspective on illness and healing has been shaped by her experiences as a doctor of internal medicine and as a cancer patient who received many courses of treatment. Our hope is that this resource helps you obtain the best care you can and live as fully as possible